6 isometric exercises that strengthen muscles at home without harming joints. After 50, the biggest enemy of training is not a lack of motivation, but the pain that shows up the next day. Knees that complain, shoulders that lock up, a lower back that signals something is wrong, and then most people stop training altogether thinking their body simply cannot handle it anymore. But the problem was never training, it was the way of training. Exercises with repetitions and weights create micro tears in the joints that, over time, turn into chronic inflammation. A study published in the British Journal of Sports Medicine showed that isometric training reduces compressive load on the joints by up to 50% compared to traditional dynamic training, with equivalent or superior strength gains. In addition, sustained contraction recruits deep muscle fibers that fast repetitions simply cannot reach. It is real strength, built from the inside out, without wearing down what you still have. That is why today you will see 6 isometric exercises to build muscle at home, with no repetitions, no weights, and without paying the price in your joints. Before we begin, please leave your name and the city you are watching from in the comments. We would love to know. Exercise number 1, isometric dead bug. The isometric dead bug is considered by biomechanics specialists to be one of the most complete and functional core exercises in existence. The name may seem curious. It describes the position of lying on your back with arms and legs raised, resembling an insect flipped upside down. But what happens inside is anything but inert. Most people train their abs with crunches and trunk raises without knowing that those movements barely activate the deep muscles responsible for truly stabilizing the spine. The isometric dead bug solves that with precision because it replicates the way the abdominal muscles actually function in real life, not in isolated movement, but resisting rotation and spinal collapse. A study published in the Journal of Orthopedic and Sports Physical Therapy demonstrated that anti-rotational isometric exercises like this one activate the transverse abdominis significantly more efficiently than traditional crunches, with lower compressive load on the vertebral discs. The main muscles activated are the transverse abdominis, the rectus abdominis, the internal and external obliques, the lumbar multifidus, and the hip flexors, forming a natural protective ring around the spine that impact exercises simply cannot replicate. To perform correctly, lie on your back with the lower back completely flat on the floor. Raise your knees to 90 degrees and extend your arms toward the ceiling. Then simultaneously extend your right arm overhead and your left leg forward without letting the lower back leave the floor at any point, and hold that position for the designated time. A tip that makes all the difference. Imagine there is a glass of water on your abdomen that cannot spill under any circumstances. That simple thought reflexively activates the transverse abdominis and keeps you honest throughout the entire set. The most common mistakes to avoid are allowing the lower back to arch even slightly, which immediately transfers tension from the core to the spine, making the exercise ineffective and potentially harmful, and holding your breath during the hold. Breathe normally. That is part of the real challenge. Perform 3 to 4 sets of 20 to 30 seconds per side, with 30 seconds of rest between them. The main contraindication is for people with a herniated disc in the acute phase or lower back pain without a diagnosis. In these cases, execution requires professional guidance before being started. Exercise number 2, isometric push-up hold. The isometric push-up hold is one of the most underestimated variations of the classic push-up, and at the same time, one of the most effective for developing real strength at the exact point where most people stall. People who do push-ups at a fast pace create very short windows of tension, especially at the bottom position, which is precisely where the chest and triceps would need to work with the most intensity. The isometric version eliminates that problem by locking the body at exactly that critical angle. Research on isometric training shows that holding the position at the most difficult angle of a movement recruits up to 20% more motor units than standard dynamic execution, generating deeper neuromuscular adaptations. The most activated muscles are the pectoralis major, the triceps brachii, the anterior deltoid, and the serratus anterior, with important core involvement to keep the body rigid like a plank throughout the entire hold. You will know you are doing it right when you feel the burn gradually set in through the chest and triceps, without the hips giving even an inch. To perform, lower into a push-up until your arms are at 90 degrees or closer to the floor, and lock there without going up or down. The body should be rigid, with the elbows controlled between 45 and 75 degrees relative to the torso to protect the shoulder joint. The most common mistakes are letting the hips rise or the shoulders collapse forward, distributing tension incorrectly and removing the load from the chest, and flaring the elbows to 90 degrees from the torso, which unnecessarily overloads the rotator cuff. Always keep the elbows controlled and close to the body. Perform 3 sets of 15 to 30 seconds in the locked position, with 45 seconds of rest between them. To progress, gradually increase the hold hold time until reaching 45 seconds per set. This exercise is contraindicated for anyone with a rotator cuff injury, elbow tendonitis, or a wrist in an acute inflammatory phase. Exercise number 3, Isometric Superman. The Isometric Superman is one of the few exercises that activates the entire posterior chain of the body at once. And that is exactly the chain that most people neglect in favor of frontal exercises like crunches and squats. The result of this imbalance over time is the postural pattern you have probably already recognized: shoulders rounded forward, overloaded lower back, and anteriorized pelvis. Training the posterior chain is not optional, it is corrective and preventive at the same time. The main muscles worked are the spinal erectors, the multifidus, the gluteus maximus, the hamstrings, and the lower trapezius, forming a line of tension that runs from the base of the skull to the heels. It is worth noting that the gluteus maximus is the largest muscle in the human body, and developing it well goes far beyond aesthetics. It is the primary stabilizer of the pelvis and one of the greatest contributors to long-term lower back health. To perform correctly, lie face down with your arms extended in front of you. Inhale, and as you exhale, simultaneously lift your arms, chest, and legs off the floor, keeping your gaze downward and your neck in a neutral position. Hold the position at the highest point you can reach without straining. A valuable tip: consciously contract the glutes before even beginning the lift. That detail completely changes the quality of the contraction and ensures they are truly the protagonists of the movement, rather than just the spinal erectors carrying all the work alone. The main mistakes to avoid are hyperextending the neck by looking forward, which creates unnecessary cervical compression, and raising only the legs without truly engaging the glutes, which strips the exercise of much of its potential. Perform 3 to 4 sets of 20 to 40 seconds with 30 seconds of rest between them. The most important contraindication is for people with lumbar stenosis, active disc herniation, or any condition that worsens with spinal extension. In these cases, the exercise must be completely avoided without prior medical clearance. Before we continue, do not forget to subscribe to the channel and turn on the notification bell. Having constant access to science-based information is what will help you progress with lasting health in the world of exercise. Exercise number 4, Isometric Farmer's Carry. The isometric farmer's carry may seem too simple to work. Hold weights and stand still? Yes, exactly that. And it is precisely that apparent simplicity that causes so many people to overlook one of the most complete functional strength exercises available. What seems like a comfortable position quickly becomes a total challenge of stability, grip strength, and postural endurance. In the isometric version, you hold 1 or 2 weights and maintain a static standing position for the designated time. The most powerful variation is unilateral, with the weight on only one side, because it forces the core to resist lateral displacement far more intensely. A study published in the Journal of Strength and Conditioning Research found that the unilateral loaded carry generates significant activation of the quadratus lumborum, the contralateral oblique, and the opposite side gluteus medius, making it one of the most effective anti-lateral flexion exercises available. The main muscles worked are the trapezius, the spinal erectors, the forearms and intrinsic hand muscles, the entire core in an anti-rotational function, and the glutes and hip stabilization. To perform, hold the weights firmly, keep the shoulders down and back, chest open, abdomen contracted, and knees slightly unlocked, and simply hold. It seems easy for the first 10 seconds. From there, the real challenge begins. The most common mistakes are letting the shoulder on the weighted side rise toward the ear, overloading the upper trapezius and losing core activation, and tilting the torso laterally to compensate for the weight, which completely nullifies the anti-rotational benefit of the exercise. Keep the torso completely upright as if a cord were pulling the top of your head straight up throughout the entire set. Perform 3 to 4 sets of 30 to 45 seconds per side with 1 minute of rest between them. Contraindicated for people with carpal tunnel syndrome, wrist injuries, or lower back instability without adequate prior strengthening. Exercise number 5, Isometric Glute Bridge. The isometric glute bridge is one of the most important exercises for reactivating a muscle group that the modern lifestyle systematically shuts down. People who spend hours sitting develop what specialists call gluteal inhibition. The hip flexors become shortened and the glutes simply stop responding efficiently. The result is a compromised kinetic chain that manifests as chronic lower back pain, unstable knees, and a lack of power in virtually any movement involving the hip. And do you know why this is even more relevant? The gluteus maximus is the largest muscle in the human body, and when it is well developed and activated, it generates a high metabolic effect, with the body continuing to burn energy even after the workout ends. The main muscles activated are the gluteus maximus, the gluteus medius, the hamstrings, and the core, especially the transverse abdominis, which stabilizes the pelvis throughout the entire contraction. To perform perform, lie on your back with knees bent and feet flat on the floor at hip width. Lift the hips until they form a straight line between the knees, hips, and shoulders. Squeeze the glutes with maximum force and hold the position. The abdomen should be firm and the lower back should not hyperextend. The most common mistakes are pushing with the lower back instead of the glutes, which you will notice by pressure or discomfort in the lower back region during the exercise and letting the knees fall inward during the hold, deactivating the gluteus medius and overloading the knee. Keep the knees pointing slightly outward at all times. To increase difficulty, raise one leg while keeping the hips absolutely level. That is the most effective natural progression for this exercise. Perform 3 to 4 sets of 30 to 45 seconds, with 30 seconds of rest between them. Contraindicated in cases of acute knee injury or severe instability of the sacroiliac joint. Exercise number 6, wall sit. The wall sit is the isometric exercise with the largest body of scientific evidence supporting its benefits, and part of that evidence comes from a place you probably did not expect: cardiology. A widely cited study by the American Heart Association in 2023 concluded that the isometric wall sit practiced regularly can reduce systolic blood pressure by up to 10 millimeters of mercury, a result superior to many moderate-intensity aerobic exercises. This happens because the sustained contraction of the large leg muscles improves vascular elasticity and reduces peripheral resistance to blood flow. Can you imagine that an exercise as simple as sitting in an invisible chair could bring that kind of benefit to your heart? The main muscles activated are the quadriceps, the gluteus maximus, the hamstrings, and the soleus, with core involvement in trunk stabilization throughout the entire hold. To perform correctly, press your entire back against the wall, slide down until your knees reach exactly 90 degrees, keep your feet parallel at hip width, and actively drive your heels into the floor as if trying to stand up without actually leaving the wall. That conscious heel activation is the detail that transforms the exercise from passive support into real muscular contraction. The most common mistakes are passively leaning on the wall and relaxing the legs, losing the muscular tension that is the entire point of the exercise, and allowing the knees to come together during the hold, distributing the load incorrectly across the joint. If you are comfortable and feel nothing, that is a clear sign you are not driving through your heels the way you should be. Perform 3 to 4 sets of 30 to 60 seconds with 45 seconds of rest between them. To progress, gradually increase the time until reaching 90 seconds per set. Contraindicated for people with severe chondromalacia patellae, anterior cruciate ligament injury in the acute phase, or any knee pain that worsens with sustained flexion. The 6 exercises you just saw are already enough to build real muscular strength at home, without repetitions and without putting your joints at risk. But if you want to finish the workout on a high note, here are 2 bonus exercises that many people overlook and that complete the work with precision. Bonus exercise number 1, dead hang. The dead hang, which consists simply of hanging from a bar with arms fully extended and holding, is one of the most deceptively simple yet powerfully effective exercises for the health of the spine, the shoulders, and grip strength. In the context of an isometric workout aimed at those who want to preserve their joints, it is especially valuable because it acts as an active spinal decompression while simultaneously strengthening the posterior chain of the shoulders and arms. When hanging, gravity gently tractions each vertebra, creating a decompressive stretch that relieves pressure on the intervertebral discs accumulated throughout the day. Regular practitioners report a progressive reduction in lower back discomfort and improved shoulder mobility within just a few weeks of consistent practice. The most activated muscles are the latissimus dorsi, the lower trapezius, the infraspinatus, the finger flexors and forearms, and isometrically, the scapular stabilizers. To perform, grip the bar with hands at shoulder width in an overhand or underhand grip. Let the body relax completely, keep the shoulders slightly away from the ears, and breathe deeply, relaxing vertebra by vertebra. For a more active version with greater muscular recruitment, pull the shoulders down toward the hips without bending the elbows, activating the lats in isometric contraction. That detail transforms the dead hang from a passive stretch into a real strength exercise, and is what differentiates those who merely endure the position from those who actually train in it. The most common mistake is letting the shoulders rise passively toward the ears, which can cause impingement in the rotator cuff with regular use. Keep the scapulae slightly active throughout the entire hold. Perform 3 sets of 20 to 60 seconds with 1 minute of rest between them. Contraindicated for anyone with an acute rotator cuff injury, severe shoulder instability, or advanced carpal tunnel syndrome. Bonus exercise number 2, isometric calf raise. The isometric calf raise is the exercise that finally makes the calves respond after years of being trained carelessly, with fast repetitions and no real control over the contraction. The calves are notoriously stubborn because they are composed predominantly of slow twitch fibers, adapted to handle repetitive loads throughout the entire day simply by standing and walking. That is why they completely ignore sets of 10 repetitions with little time under tension. Rising to the tips of the toes and locking at the highest point without letting the heel give even a fraction places the gastrocnemius and the soleus under maximum sustained tension, exactly the type of stimulus these muscles rarely receive in conventional training. Beyond hypertrophy, well-trained calves have a functional role that goes far beyond aesthetics. They are considered the second heart of the body because they help pump blood back to the heart against gravity. Strong calves protect against varicose veins, swelling in the lower limbs, and contribute directly to cardiovascular health, in addition to being fundamental for balance and fall prevention, especially from the age of 50 onward. The main muscles activated are the gastrocnemius, the soleus, and secondarily the toe flexors and the intrinsic muscles of the foot. To perform, stand with your feet parallel at hip width, rise as high as possible onto the balls of your feet, and lock there, squeezing the calves as if you wanted your heels to touch the ceiling, and hold without swaying. The most common mistake is not reaching full range of motion before locking, initiating the isometric contraction at a midpoint where the muscle is not under real tension. To increase difficulty, perform on a step, on one leg, or with extra weight in your hands. Perform 3 to 4 sets of 30 to 45 seconds with 30 seconds of rest between them. Contraindicated for anyone recovering from an Achilles tendon injury, plantar fasciitis in the acute phase, or a stress fracture in the metatarsals. If you enjoyed this and want to discover 5 exercises using only a wall to strengthen your body without damaging your joints, we have a video appearing on screen right now showing each one in detail. Make sure to check it out. Thank you for watching until the end, and God bless you, my friend.